Okay, Pahrump, we're back from this short break, and tonight I have guest Melanie Lentz on the show. Thank you again, Melanie, for showing up. She's our newest nurse practitioner in the Independent Medical Group and the Independent Wellness Center, and we're honored to have her work with us, and I want her to be on the show that you guys out there and you customers and patients and people like that can see her and get to know her a little bit, because she has plenty of openings in her schedule, whereas I don't, and she works right beside me in the office. So, you know, we're there to help you get in, to get seen. If you're having a hard time getting into your doctor and you want to think about making a change, I think you ought to give Melanie a try. I think she'd be very happy to take care of you. And we talked in the previous show that Melanie was at the hospital. The previous segment, you worked there for, what, 14, did you say?
I've been a nurse for 14 years.
But you've been in Pahrump 7 years.
Yes.
7 years. And you recently graduated from APRN. You've been working now as a licensed advanced practice registered nurse. Kind of a mouthful.
I know it is.
But you've been doing that for about, what, 4 months now?
Yeah.
Right.
Yeah.
And she was previously employed by Mountain Valley Physicians Group and working with Dr. Bill Craig. And that kind of went by the wayside as the hospital decided they no longer needed primary care when they sold to the Valley Healthcare System, or what is that, UHS, United?
Yeah, United.
United Health Systems. But that's not United Healthcare. It's United Health Systems, right?
Yes.
Totally different.
Yes.
Totally different. But they own a lot of hospitals. I think that, and Hospital Corporation of America and things of that nature. But we were talking a little bit about the break about PAs versus nurse practitioners, and how I like the fact that, you know, you have a lot of clinical experience before you go into becoming an advanced practice nurse. So
yes.
It isn't like you just completed MA school and thought you could do it better than the doctor and decided to go to PA school. And I like the fact that you can make your decisions independent. And the nursing board, that was the thought I had, was that the nurses, the reason I like nurses, nursing board controls you, right? So you have a scope of practice, and the nursing board is very clear about the scope of your practice. And that's not something, doctors hold the ultimate scope, the ultimate umbrella. We can do whatever we want to do, but we're kind of like have some controls. I mean, I could do brain surgery in my office, but it would be a disaster, and I would lose my license as a result of that. As a nurse, your scope of practice, if you go outside and do that and you're not trained in that area, you could lose your license for doing that.
Yes.
And the nursing board is very stringent. I think the nursing board is harder on you, the nurses, than somehow I think the medical board can tend to be hard on physicians. So they're very strict in that respect.
Yeah, they are. They have a very set of rules and regulations we have to follow. So
yeah, and that's good. I mean, it kind of keeps you, but it's good to take your clinical experience and you go all the way through. And I like the fact that, you know, you were a nurse and you got, you know, you kept moving up the ladder to be something better and fulfill that. Because I think as a nurse, you really do see these things that doctors do, and you do question them, and you do want to make that decision. But at the same time, it's also what is it? How do I want to say it? It's I guess it's the other side of the coin, right? The grass is greener on the other side, and you get there and you realize, oh my goodness, you know, it wasn't that easy, right?
No,
right.
no.
But that's how you learn. That's how you learn. I mean, to say that I didn't make any mistakes in medicine is to say that I didn't try anything. And I think the key, for me at least, was if I had to have a method to my madness. If I didn't know the reason why I was doing something, then it wasn't correct, right? So, I mean, and I also had follow-up. So, you know, the follow-up of your patients, you know, I'm going to do this for you and I want to see you back in a short order, because that's kind of what you do.
Right.
You know what you do. And medicine today is changing. You know, Medicare is changing to more of wellness exams. Okay, and I think you're good at that. You enjoy those.
I do.
Yeah.
I do enjoy those.
Yeah, and you get to know the patient. You know, and it's about lifestyle, nutrition, things of that, the things that really make a difference in disease prevention rather than disease treatment. Because Medicare has to change the way it pays doctors and the way it pays you. Because if we're not preventing your diseases, then they're going to reward us as doctors for keeping you healthy, keeping patients healthy, as opposed to treating this, oh, well, go ahead and smoke, drink, do whatever you want to do, and I'm here to take care of you. They're trying to incentivize patients to do colonoscopies, to try and do the things like that nature. And I think that's a great role, one of the things that I think, that's really good for nurses. Not that there aren't other things that you can do.
No, I think that's one of the bonuses of being a nurse for so long, is because health and wellness is one of the things that nurses do. I mean, we teach that all the time.
You do.
So I think that was a huge bonus going into this.
I couldn't agree with you more, because the doctor gives you instructions, and you had to go behind the scenes and educate the patients on what this medication was, why to take it, what to look for. So you've already done that. You made a career of doing that. And so now you get to not only make the treatment, but then you need to tell the patient the treatment.
Right.
And that's good. I mean, that's good. And I think, a lot of people will start calling you Dr. Melanie. That's now, do you have a doctorate, or do you just have a nursing degree?
A master's.
Master's. Okay. So I knew a nurse who had a doctorate, and she would say, I'm Dr. Nurse, and I was like, okay, that's a little confused. But it was totally legit. But it was totally legit. It went to that person's head, and that was a bad thing. It was a bad thing. You ever done any surgery?
No.
Never? Assisted anything?
No, that's one area in my nursing career. I did not ever work in OR. I took care of patients after they came out of surgery, but never assisted in any surgeries.
No, never OR surgery?
No.
Well, that's okay. I mean, listen, it's a sterile environment, right? No, it is. I mean, you can't, it's just everybody's gowned and gloved, and it's just, surgery is a totally different animal. I got to do some when I was training, and it was kind of exciting, to get in there. I didn't mind the blood and guts, but some of that stuff was pretty interesting. I got a very high mark in the cardiovascular surgery I did, because when I was sewing up the vein, when they were doing that, I had perfectly straight lines, and the cardiothoracic surgeon looked over and says, "Boy, you can really sew, can't you?" And I said, "Yeah, I can." And so it was a lot of fun. I actually did, the only thing I did in training was I actually did a bone graft. I mean, actually, I was the one harvesting the bone off a hip and doing it. So it was a cool orthopedic surgeon. I think he was just tired that day to let the medical student do it. And so now if you go into, the patients are hearing that. If you actually do go to surgery in a training center like UMC, and you're doing that, you actually have to tell the doctor you do not want the training people to do the surgery. You have to literally spell that out. So if you have an elective surgery, you have to say, I want just you to do the surgery, not the other people. And they'll do the major surgery, but they may have somebody do the cleanup or the close-up and stuff like that. You ever had a chance to do any deliveries?
Not me personally. I've watched several, but I have never delivered.
Never delivered?
No.
No. Well, you have some children?
I do.
So you have delivered?
But
you've never been there to catch the baby,
I've never
right?
caught the baby.
Yeah.
So.
Well, having to deliver the baby and then having to catch the baby, I think, you would understand a lot.
Yes.
Yeah. OB is kind of interesting, but high risk, I think. So, that's one of the things. And peds, you do well child checks? Or you kind of?
Sort of, yes.
Sort of, okay.
Yes.
Well, children checks are, we don't do immunizations in our office, but we are going to be doing them.
Yeah, I do well child checks, but I was wondering about the whole immunization part of it. I didn't think that we did immunizations. So.
Well, it's a whole process. We have to go back to the state and get that accreditation, but that's something we are going to do. Our Beatty Clinic is an immunization center, and you might do some time up there if occasionally do that. So immunizations are a big part. Some people believe in some people don't. But that's one area. If you have a child and you want to bring them here, you know, we'd be happy to do the checks, and we do take Medicaid. So, and sometimes pediatricians are hard to come by. So if you, you know, we definitely want to take care of those runny noses and those ears and things like that. We can do that. So you're good at doing that. So, and then what else? Obviously, we live in a retirement community, COPD, heart disease, all that other stuff. And then, so next year, if you need a wellness exam and you're Medicare and you need to come in and get that, we're going to start doing that a lot. So please come in and see you and get that wellness exam, because Medicare has expanded that ability to get that, and we do a whole set of screening procedures, you know, depression, things of that nature, nutrition to get you set up for that next year. Well, we're just about out of time. I want to thank you again, and I really, to the audience, please come in and see her and give her a chance. I think she's going to be a great practitioner. Welcome aboard.
Thank you. Thank you for having me, and I look forward to working with everyone.
Yeah, that's great. Thank you. Thank you, Pahrump.